Hello, my name is Gregory Wayne, and today I will be presenting on G6PD deficiency testing before vivax treatment. So a little bit about myself. I am a rising senior at St. Andrew's Episcopal School in Potomac, Maryland, and I am a volunteer for the G6PD Deficiency Foundation. I'm also president of Creature Eye, the school literary magazine, and I am an avid jazz marimbist and vibraphonist. Last year, I attended Yale Young Global Scholars Innovations in Science and Technology, as well as Georgetown University Biotechnology for Science and Health Academy. And I'm interested in public health and policy. So what is G6PD deficiency? Well, G6PD deficiency is a deficiency of the enzyme glucose-6-phosphate dehydrogenase, or G6PD. And G6PD prevents cellular damage caused by reactive oxygen species, unstable molecules that are prone to reacting with other cellular molecules. Red blood cells are especially vulnerable, so hemolytic anemia can occur in G6PD deficient individuals as a result where red blood cells break down more quickly than they can be replaced. And this can lead to heart failure if left untreated. G6PD deficiency is also inherited on the X chromosome, so men tend to be impacted more by this deficiency than women. And the deficiency is also the most common enzymatic defect worldwide, with over 400 million individuals living with it, including me, which is why I am very passionate about this topic. So hemolytic anemia occurs in G6PD deficient individuals upon exposure to specific triggers. And this includes certain foods, medications, and substances. And the severity of the anemia varies by the individual. Some can tolerate small quantities of these substances while others cannot. Some examples of these triggers are fava beans, aspirin, henna, mothballs, which have the chemical naphthalene, and malaria medications, which will be the focus for today. And there are also many other triggers as well. And complications tend to only occur when exposed to these triggers, so G6PD deficiency is very manageable, but prevention to exposure of these triggers is absolutely key. The problem: limited testing before malaria treatment. Individuals with G6PD deficiency who are unaware of their condition often receive anti-malarial medications that are dangerous for them. For example, individuals with the Mediterranean form of G6PD deficiency would likely die from the 14-day regimen of primaquine. As a result, the World Health Organization recommends G6PD deficiency testing before treatment. Malaria is concentrated in tropical areas where G6PD is most prevalent. And interestingly, this is not a coincidence. G6PD is speculated to protect against mild cases of malaria, but not severe. Malaria is still a persistent threat to this day, with 249 million estimated total cases in 2022. And G6PD deficiency is also a threat today, with 33,000 estimated total deaths in 2015. For the purposes of today, I will be focusing on the form of malaria Plasmodium vivax, as 2.5 billion individuals are at risk of infection from it. So the question: how do we increase G6PD deficiency testing before vivax treatment in areas where G6PD deficiency is prevalent? Well, first we have to recognize that testing is a global challenge, and this map represents the policy, indicated by the colors, and implementation, indicated by the textures, of G6PD testing before malaria treatment. For example, in Ethiopia, testing is not required and it is also not implemented, whereas in Thailand it is required and it is implemented. In India, it's recommended but not specified, and unfortunately it is not implemented. And this map communicates that solutions need to tackle both policy and implementation. On the policy front, data collection about G6PD deficiency in a population can lead to a change in policy. In a study by Desolé Lick and others in 2024, 8 to 15% of the Cambodian population has G6PD deficiency. And Cambodia, as a result, included testing for G6PD deficiency in phase 1 of its malaria elimination plan using radical cure, which is a combination therapy to eliminate malaria in the body. And this testing prevented serious injury for G6PD deficient patients, since it allows for the implementation of a modified treatment plan. And as you can see on the table on the right, with the example radical cure regimens, they include antimalarial medications that can cause hemolytic anemia in G6PD deficient individuals, which is why testing and allowing for the implementation of these modified treatment plans is very important. On the implementation front, a study by Benedict Lay and others in 2025 interviewed healthcare workers and policymakers in malaria endemic countries in Asia to find trends and obstacles to implementation of G6PD tests before treatment. In Bangladesh, they found that one of the obstacles was poor pharmacovigilance systems that detect hemolysis. In Cambodia, it was a lack of training on G6PD deficiency, whereas in Malaysia, one was that the fluorescent spot tests for G6PD were sometimes inaccurate and hard to interpret. With these obstacles and trends in mind, solutions would be first, educating healthcare professionals on drug-induced hemolysis threat to make sure they're aware of the complications that can occur. Stronger guidelines on treatment for G6PD deficient patients would be second, since more accessible and standardized information would help avoid confusion in the midst of medical emergencies. And lastly, cheaper and more effective tests, such as point-of-care tests that have a shorter evaluation time and less necessary expertise to use, would lead to better implementation as well. In fact, in recent history, more countries have had better implementation due to these tests. And you can see one of these here in the lower right-hand corner, an advanced G6PD analyzer. This one only has a 2-minute test time, so it will be very easy to quickly test G6PD levels before treatment. So in conclusion, data collection, education, and technological innovation and expansion can lead to increased testing for G6PD deficiency before PVivax treatment. I would like to thank Ms. Jabari and the G6PD Deficiency Foundation, as well as my friends and family for supporting me, and of course the Global Health Leaders Conference team for granting me this wonderful opportunity. And finally, I would like to thank you for listening to my presentation. Here are my references, and thank you again for listening. If you have any questions, please feel free to contact me via email.